the health department has allayed fears about Flurona. Dr. Edsel Salvania said this isn't unusual and that the first COVID death in the country last year had both influenza B and the coronavirus. Let's get your questions answered about Flurona with Dr. Paolo Garcia from the Philippine Society for Microbiology and Infectious Diseases. Good evening, Doc Garcia. So let's explain this in simple terms. What causes Flurona, and is this something to worry about?
All right, so basically it's just a combination of an influenza infection as well as COVID-19 brought about by SARS-CoV-2 infection. And it's not actually a newly discovered disease. So, and it's not another variant, or it's not a mutant strain of SARS-CoV-2, because these two respiratory viruses can infect a person or any susceptible patients or individual. And we all know that COVID-19 can cause really deleterious effect to our bodies, and that can cause a multi-organ dysfunction. But studies have shown that viral co-infection among patients with COVID-19 is being associated with a disease severity. It can have really serious acute respiratory distress syndrome, a secondary bacterial infection that could predispose the patient to having a high risk of mortality or even death.
Okay, doctor, but we have seen that Omicron is spreading rapidly. Now, who are at higher risk of contracting both influenza and COVID-19?
Basically, the risk of contracting influenza as well as SARS-CoV-2, particularly Omicron viruses, may have a somewhat close similarity. So still those patients who are on older age with metabolic diseases such as uncontrolled diabetes mellitus, hypertensive cardiovascular diseases, those patients who have a weakened immune system, like for those patients who have a cancer or leukemia and are receiving chemotherapeutic medications, rheumatologic patients who have been receiving chronic corticosteroid use, or even those patients who have HIV who have really depressed CD4 levels. So those are the patients who belongs to the high-risk category of contracting influenza as well as COVID-19.
Mm-hmm. But is there a way to test to find out that you have Flurona?
Okay, so influenza as well as mild to moderate COVID-19 symptoms, COVID-19 disease would be a little bit difficult to delineate based on the clinical manifestation. So a majority of cases of influenza were diagnosed in clinical grounds and in selected circumstances. So diagnosis of influenza can be confirmed with a different rapid diagnostic tests as well as nucleic amplification test or PCR. Well, we all know that COVID-19 can be confirmed with an RT-PCR. In certain cases, we can also request for those patients who have admitted when we've been suspecting for multiple or possible co-infection, we can request for a multiplex PCR wherein we can detect different respiratory pathogens, whether it's a virus brought about by influenza and SARS-CoV-2, bacteria that can cause atypical pneumonia, and different bacterial infections that can cause super infection on the premise of having an influenza pneumonia.
Okay, Doc, now that we know who are at higher risk of contracting Flurona, now what could be done to avoid contracting the flu and also COVID-19 simultaneously, especially now that it's the flu season?
Okay, so basically your influenza virus as well as SARS-CoV-2 can be spread by means of infected aerosol particles. So we just have to remember 4 ways of transmission, and we have actually tools at hand already. So those 4 factors that drives this transmission would be the virus itself. Influenza is highly contagious, as well as the SARS-CoV-2, particularly Omicron as well as Delta. So there will be an increase in transmissibility brought about by these 2 viruses. Mixing So the social mobility as well as mixing brought about by this recent holiday season could actually drive the people together. And if this intervention will not be put in place. Another one would be appropriate use of public health and social measures. So this can be a combination of intervention from an individual level to a community level, meaning you have to wear your mask, observe physical distancing, hand hygiene, avoiding avoiding crowded indoor spaces, no? And as well as you already have the symptoms, learn to isolate yourselves from the rest. And the vaccine will work. COVID-19 vaccine or having a booster shots as well as influenza vaccine.
Okay, so we now know that boosters, vaccines are important against COVID, especially with the threat of Omicron. But also tell us about the flu vaccines and the pneumonia vaccine. How often should we get them, Doc?
All right, so influenza vaccine, we have to update it yearly. So every year, influenza vaccine are being manufactured based from the strain that are being studied in the surveillance from the different countries. So you have to get your flu shots every year, preferably around 1 to 2 months prior to the flu season. And your pneumococcal vaccines. So we do have different pneumococcal vaccines. We have the conjugated or your PCV13 that can be given, and then after a year, it can be followed with a polysaccharide or pneumococcal polysaccharide 23 vaccines. So meaning it has 23 serotypes. And for those immunocompromised, you can give a PCV13 to be followed by PPSV 23 after 8 weeks.
Pero very quickly, Doc, yung pneumonia vaccine po ba, recommended po ba yon sa mga seniors lang po? Or how early can we get them? At what age?
50 to 60 years old, you can already, it is really recommended to receive a pneumococcal vaccine. For those patients who are immunocompromised also, we recommend it among those patients who have HIV also.
All right, thank you so much for your time. Dr. Paolo Garcia, good evening to you, Doc.